Good afternoon. This is WBFO News Director Dave Debo. Welcome again to a weekly chat on your mental health during the COVID-19 pandemic. This week, we look at what the first responders and frontline healthcare workers need to know to be able to cope with this. Psychiatrist Sourav Sengupta is here. He's with UBMD Psychiatry and the Oishei Children's Hospital. He's working with a task force at Kaleida, helping the healthcare workers. And Dr. Sengupta, thanks for being here. To start, let's define who those workers are and why you've needed to launch a task force, because you're not necessarily talking about just doctors and nurses here.
That's right. Mr. Debo, again, just thanks for having me and for helping us talk about these important issues here. So, I'm a psychiatrist and I have the privilege of working with a lot of different providers in different settings, whether that's in primary care settings or in the hospital settings. And one of the things we were getting a sense of was that, folks were, really concerned about what was coming to, to be affecting our community. And folks were thinking certainly about, their clinical duties and how to best take care of our patients. I think folks were also concerned about, how they were going to take care of each other, just as a team and sort of work together. As healthcare workers, I think we had a sense of, we were really dialed into what was happening in Wuhan, what was happening in Italy. And it was really sort of, on everyone's minds. And there is the team that's taking care of patients, day in and day out. And one of the things that we also, really know every day is that team is big. Certainly it includes clinicians, and at the same time, the custodian that comes in and needs to clean rooms after a patient leaves. Our food service workers that make sure that our patients are getting healthy meals every day. Our aides that are making sure that the needs that patients have day to day, moment to moment are being met. Everyone on that healthcare team, was really being impacted. We really understood that. There's a lot to reasonably feel concerned about, and at the same time, our sense was that this is an area where maybe we could be of some service and some help to kind of our team members as well.
So you have a task force that works on this directly with those frontline people.
That's right. So what we tried to do was to really try to kind of make it an easy way for them to touch base with us if they needed to get a little bit of emotional support. They can call into our warm line number, get a chance to talk to one of our UBMD psychiatrists. And sometimes really all we're doing is helping them work through a specific, concern or worry that they might have. Sometimes it's a bit more specific. Maybe they're having a little challenges figuring out how to get to some good sleep at night, or maybe there's some a family issue that's coming up. And we're really trying to do some quick problem solving with them. But sometimes folks need a little bit more, and we can help them connect those folks with the right types of services out in the community as well.
I'm careful not to think that we all aren't going through something. Yeah. I think everyone is touched by the pandemic right now. But I also want to make sure that there are people in the audience, if they have a specific question, if they're going through something, that they can type their comments here on Facebook. We'll try to answer them. And yes, that is if you're a frontline healthcare worker, or if it's just someone who is dealing with stress, because face it, we all are. We're here to take the next bit of time and really get your questions and comments on board on Facebook. What questions or what concerns are these workers bringing to you, Doctor?
Sure. I think a lot of them are the ones you might expect, wanting to make sure that they're at their best, they're doing their best to take care of their patients. I think there's also just a fair amount of anxiety about, look, as healthcare workers, I think we're all, willing and able to take, certain risks to make sure that we're taking care of our patients. But this idea that we might bring some of that risk home to our families. And I think that's a very understandable, anxiety, and one that, we've wanted to and been able to kind of help a couple of our folks work through. And I think that's one that really resonates, wanting to make sure that our family is safe at home. Sometimes, again, there are these sort of very specific issues. I mentioned sleep. Sleep is a really common issue. As we wind down for the day, it's natural for us to be focused on, reviewing sort of challenging incidents of the day, or, maybe having some worries about what's to come, and, really trying to help them with some strategies of how is it that we find a way to still, bring our mind to a close for the day, that kind of thing.
I also imagine too, I realize if I take the time to stop and think about it, that COVID-19 is serious. I realize if I take the time to stop and think about it, that people are dying. But I'm not a medical professional. Those concerns to me are not as automatic. I would imagine the more you know about medicine, the more fearful you could be.
That's a really important point. I think here, those of us, in the healthcare professions, it's been hard not to really attend to what's been going on all across the world, really, as it's sort of slowly marched closer and closer to our shores, then into our communities. I'm a psychiatrist, I recognize that, and yet I have a little bit more knowledge about, what the experience is like, of a team operating in ICU, or when it means that someone might be intubated. And, some of those, worries and stresses, for any one of us in the healthcare fields, we have a little bit more knowledge, perhaps, maybe than the public, about what some of these experiences might mean, how they might impact us. And yet we're also not necessarily, not all of us are necessarily the experts. We're not all, critical care physicians, or, ICU nurses. And so, some of us are in a little bit of that middle zone where we have more knowledge, but we may not necessarily have quite as much as some of the experts. And I think that can sometimes really amp up some of our anxieties that are out there.
I imagine too, if I'm a healthcare worker, I knew about this from the get-go. Early on, I said, oh, gee, COVID is a possible pandemic. For these people who have that extra knowledge, the curve or the wave is longer. It's coming at us for more than just the 2 or 3 weeks that I've been paying attention. These people started paying attention earlier, therefore for them, it's a longer event, no?
Absolutely. And so we have the prolonged sort of wave coming towards us, right, in a slower fashion than other sort of disasters and catastrophes occur. And then we have, unfortunately, the challenge that we're having now in our community and communities across the country, where, we're going to have this prolonged, sort of, presence in our communities. With, to a certain extent, many of us in healthcare have some familiarity with, a disaster striking or catastrophe striking a community. But, there's there's a big spike and wave of, of work you have to do, of energy you have to expend, but then afterwards, it dissipates, and we're not necessarily seeing that clear dissipation. And we're really having to continue to maintain our guard, maintain our alert. And while we're doing that, we don't necessarily have the benefits of a lot of our sort of normative, happy buffering, options, in terms of extended family time, the ability to spend, good time with our colleagues to help, sort of process those things. We have to also be physically distant. And so it's a little bit of a triple whammy, if you will.
Okay. If you are a healthcare worker out there, we'd love to let you, or have you let us know that you're here. I know it might be hard along the way to end up really talking a little bit more about Facebook's not anonymous. And so I imagine without a lot of anonymity, it might be tough for some of you to share your stories. But if you're comfortable doing that, what is your day like? What stresses are you seeing? You can be asking for a friend. We will not dig any deeper than that. But if there's something you want to get some advice or some help with, we can offer that. And we encourage folks to come along the way and add their comments here right on Facebook. Doctor, I don't know if there's any delicate way I can ask this, but how have you had people dealing with grief? How much of an issue is it when folks are seeing people die?
Absolutely. Grief is always such a challenging, presence when it enters our lives, and there's a normative sort of response that we all have. We're missing the person that's gone from our lives. We're missing the benefits and supports they gave us. But one thing to keep in mind is that everyone grieves in their own way. We've had folks that have communicated with us that, they really wanted to get back to work. That's a positive way for them to interact with their community, to give something back, those kinds of things. There's other folks that have really needed to take a step back. And to a certain extent, though, I think certainly healthcare workers, I think essential workers, they're experiencing in some ways different kinds of grief as well. There's a loss of experiences. There's a loss of kind of normative community experiences that, folks are missing out on as well. And so, each of us can process the loss of these experiences in different ways. And I think one of the most important things is to really give oneself the space to experience exactly what you're experiencing, acknowledging that this is a challenging time right now. But then hopefully still finding some ways to connect out with other people that we care about, connect up with, other supports that, can make a difference in our day-to-day life.
I also want to ask a little bit about personal risk management. I would think that even with the best PPE, protective equipment, that there's got to be some anxiety around that issue too. Am I safe? If I don't think I am, that's probably going to contribute to my stress level too.
Absolutely. Especially towards the beginning of the pandemic, there was this, such intense, really international concern around, personal protective equipment and were folks going to have what they needed to kind of protect themselves. And I think, certainly in the healthcare fields, and I'm sure essential workers as well, I can't imagine that this was not a significant sort of anxiety provoking thing. There was a lot of differing information about, how the virus might have been transmitted. And unfortunately, anxiety grows in the presence of a lack of information, right? And I think in the beginning, especially, we were struggling in that way. I will say that, in the local healthcare environment, I've been really pleased with the way that, the larger healthcare organizations have really worked hard to bring in, the personal protective equipment that they can. And yet, that early kind of the worries about, what will we have available to us? What will we have to do with, what's available to us? I think that still lingers on for a lot of folks. And I think that can contribute to, some real emotional challenges. Even as you get the equipment that you need, we're still at a heightened state of alert, a heightened state of concern.
Some of the stress that people are experiencing in the hospitals has got to be similar to the stress that the general population is feeling. How is the healthcare workers' stress different? And if it is different, how does that present you with a different set of problems? Do you treat stress differently if it's, say, healthcare workers' stress?
Sure. I do think the day-to-day experience for healthcare workers may be somewhat different than the stressors that the public is experiencing. And I do want to be, very upfront that, I think the stress that the general public experiencing is very significant, right? We have this sort of sense of, what's happening in our community. Am I going to be safe? Is my family going to be safe? And that's something that's, I think, baseline for all of us. But sort of additionally, on top of that foundation of stress, that community stress, we have a lot of, healthcare workers that are, we have some, they're going in every day, to, care for folks, many of whom, have the illness or are at risk for getting the illness. Thinking about folks in nursing homes, right, where, the entire population there might be at heightened risk. So for them, there is that sort of the foundational community stress and then, workplace stress really on top of that. That's really closely tied into the possibility of, transmission of the illness. Although at the same time, as we're finding out more and more, they're also often at the cutting edge of being able to find out ways that they can keep themselves protected as well. And I know they're working hard on that. But in terms of helping them manage their stress, I mean, about 90% of it is very, very similar. We're working on the similar types of strategies in terms of acknowledging, the challenging situation and really trying to find ways to, really regulate ourselves. And maybe about 10% of it, though, is a little bit different. I mean, one of the things that's different, it simply is the way that often, many of us were trained, as a physician through residency, perhaps a clinician, a nurse through nursing school or through PA school. there is a certain amount of stress that comes up in that training environment. And sometimes one of the things we're able to do is to help folks connect with how they've gotten through stressful and challenging experiences in the past. I think most healthcare workers have at times been through some stressful experiences. And one of the things we're trying to help them understand is that, they can build on their past successes and past experiences and, connect with the strength and, the foundations that they've already really well established and try to use them now to solve the current sort of challenges ahead.
Shared experiences with your coworkers. They know what you're going through, therefore storytelling from them with them is a good thing?
So, there's a little nuance to that. I think having an individual person, that you can share your story with, your challenge of the day with, that can make a big difference, right? Someone that can hear you, someone that can validate, and really maybe if you're ready for it or you're wanting it to help you sort of solve a problem, that can be really helpful. The one thing we do sometimes caution a little bit against is, kind of the group vent session, so I share something that's been challenging about my day, and then another person shares something that's just as, if not a little bit more challenging. And then before you know it, you get a little bit of a domino effect of kind of increasing stress. And we're not really sure necessarily that that's always necessarily the most helpful experience. Yeah. We want to keep it, focused a little bit on kind of being able to work better, find a way to feel better.
Sure. WBFO's mental health initiative, by the way, is funded by the Patrick P. Lee Foundation. If you're just joining us, Sourav Gupta is here. He's a psychiatrist from UBMD and Oishei Children's Hospital. And we're really hoping, wishing that some of you who are in the healthcare setting can share some of your stories with us. We're trying to work up some specific advice for folks that are exactly suffering through being on the front lines. And again, the front lines could mean anything from perhaps being a janitor to being a nurse, obviously a doctor. We'd love to have you aboard as the conversation moves ahead. How hard is it, doctor, at the end of the day? And I know this is kind of an obvious question because personally, I've had problems with this. How hard is it at the end of the day to turn things off?
I think folks are finding that very difficult at this point in time, right? In some ways, there's really still a vacuum in some ways of certain types of information that I think everyone is hungering for, right? So how exactly, how long will this be part of our community? How long before we get, some accurate, some treatments, vaccine, these kinds of things. And I think in that vacuum, folks naturally have a hunger to search for more and more information as best they can. And I think in some ways, sometimes that can go a little bit against our mental health. If we find ourselves, sort of constantly, searching, constantly scrolling, it can really, frankly, be sometimes overwhelming. One of the things we really talk about is just really wanting to make sure that folks can think about some ways to sort of regulate that a little bit.
And how do we regulate that? Do I unplug my phone at the end of the night?
Dave, I bet for you that might be a little bit difficult, but
yeah, exactly.
And I think, for many of us, I think for a lot of healthcare workers, it can be challenging to kind of make a complete clean break. We can't, necessarily just completely turn off, all internet, all phone, those kinds of things. Part of our job often is to be available to help others, and that's part of the job description, so to speak. One thing I will say, though, is that, I think to be a healthcare worker, to be an essential worker in this day and age, requires us to be, consumers of information, and frankly, relatively constantly. But I think we want to be good consumers, and if we're finding ourselves sort of scrolling kind of all day long, and in some ways, maybe not necessarily feeling better from it, we may need to really take a step back. We kind of talk about the idea maybe of a media diet. Do we want to make sure we find, maybe one or two really reliable resources that we can turn to on a regular basis? Do we want to really cut it down to maybe just once, maybe twice a day that you sort of check in, you get yourself updated, and then sort of check out and get back into, what you need to be doing, what you want to be doing for your day?
I imagine what they call sleep hygiene is part of it. The idea that at night, I shouldn't be on this phone. And if this phone's not busy, I shouldn't be on this other one over here. I'm a junkie. What can I say? But I imagine too, part of shutting it off is just that. When you're in bed, you're in bed.
Absolutely. So one of the big things that we talk about, certainly with folks that call in, and I think again, I think healthcare workers, I think really largely the general public understands that we need to take care of our sleep and our sleep habits. But again, in this sort of state of flux, I think folks.
It looks as if your camera has froze on us just a little bit. We hope to. Okay, there you are. You're back.
Sorry about this. So that
the joys of doing live internet television in it.
There you go.
But you're here. Thanks.
Right. So in this state of flux, I think it's natural that folks will feel like this is exceptional. I need to find this information. I need to keep making sure I keep myself, my family informed. But those regular sleep, good sleep habits still apply here. One of the major things we talk about, frankly, is an absence of screen time before we're going to bed. About an hour's worth where we're sort of away from TVs and tablets and phones. And also usually, some kind of routine to sort of quiet our minds, whether that's, engaging in, just some light reading, listening to some music, those kinds of things. But it pays to have a routine to actually actively quiet our minds before we head into bed.
I want to talk a little bit more about what you folks are doing specifically at Kaleida. I know obviously it's not universal per se. Yes, there are other healthcare systems, but yours is the largest healthcare employer around here. So take me through some of the steps. There are specific chunks or prongs, I guess you call them, of your approach. A three-pronged approach. Tell me what's going on there.
Sure. And so one of the things we were really hoping to do was to broaden the access as much as we can. So we're delighted to take folks, that are calling in from Kaleida or ECMC. Some of the major, larger healthcare organizations in the area. And so one of the things, the first line, if you will, we're trying to offer is simply someone to talk to. So there are psychiatrists that are staffing the line. I have some amazing colleagues at UBMD Psychiatry. And, folks are, providing some of that initial, whether it's problem solving, a little bit of, okay, so what's going on? Let's think about this. How do we, think through the different options? How do we help figure out how you can make a good decision here? Sometimes it's simply teaching them a little bit about their own emotional regulatory sort of strategies. And again, a lot of times healthcare workers in general, they have some sense of this, but it's about reminding them and getting them sort of like, maybe we need to try this one specific track, let's go through this together. I think that's a big part of it, is having someone that can sort of remind you and maybe coach you a little bit through that. Sometimes it's a interpersonal issue as well, and we might help them sort of think through some different options there.
And you referred to it earlier as a warm line, not necessarily a hotline. That's interesting to me.
Right. Hotlines, we think of it sort of after things have already sort of boiled over. And our goal here is to really, as things are building up, we want them to be able to feel comfortable calling, before things really reach that, kind of boiling over point, if you will. And our sense is that, folks have been utilizing this in that way. And I think that's a good sign for the community.
And who answers the call? Is it a team of psychiatrists?
So it's a team of psychiatrists, and we're available from 8 a.m. to 8 p.m. And that's it's been a way that we can make sure that we have the folks have access to someone that they can talk to. Certainly, hopefully between shifts, we wanted to make sure we covered sort of multiple shift periods, and certainly also including some afternoon and evening times as well. And then sometimes though people need a little bit more than just that initial emotional support. And so so our second prong, if you will, has been just an outpouring of support from our wonderful community of therapists in our area. And so we have a whole number of therapists. Actually, every single therapist at the Children's Psychiatry Clinic at Oishei has volunteered to help, as well as other therapists in the community, to provide free sessions, 3 to 4 free sessions of support for any healthcare worker that's calling in that wants to work on something in a little bit more depth.
Go ahead. I'm sorry. I didn't mean to cut you off.
No, not at all. But also, we also have right next to them a community of therapists as well that have agreed and have to sort of, if someone does also want to work on something longer term, they're right there, sort of waiting. I think, again, that's just an expression of the support and care and concern folks have for our frontline workers, and wanting to make sure that they have some options available if they want to get into some of that deeper work.
For those who aren't part of that system, which is specific to Kaleida, and I know we don't want to necessarily put it out to the public here, but there are certainly other resources.
Sure.
Crisis services comes to mind, right? That's the obvious one. What else is out there? Let's talk about each one.
Absolutely. So I definitely want to make sure we spend some time, reviewing, again, the amazing work that Crisis Services does in our community. Just to review for your, listeners, Crisis Services is a place that folks can call. So it's 834-3131. They're open 24/7, every single day of the year, with any kind of a mental health crisis or urgency. And they have trained, licensed mental health counselors that are on the line to be able to help folks work through, challenges and problems. And they can sometimes go out in the community, although they're doing it perhaps in a slightly different way at this point with the pandemic. There's other ways too. Sometimes folks are a little bit concerned about the idea of having a conversation over the phone. The National Crisis Text Line is another great option. So you text the word HOME, HOME, to 741-741. And similarly, they have crisis trained mental health folks that can help one walk through, kind of an urgent moment as well. And then actually New York State has a really wonderful emotional support line for the general public. So that's 844-863-9314. And they're available throughout the day as well. And so there's some really wonderful resources. I think, again, this is a good sign of our community coming together and making sure that we're available for folks.
And as this broadcast wraps up, we will type those right onto Facebook. So if people didn't get them, they can see them right in the scroll of the comments. Crisis Services, 834-3131. The national text line, text the word HOME to 741-741.
Right.
And then the last one, New York State has one. I only got part of it.
844-863-9314.
9314. Okay, very good. And we'll have those up on the list here. We're taking your I don't want to say we're taking your calls. That makes it sound too much like a radio call-in show, but it's that kind of informal thing where we're here for you to give your people advice. If you have a comment that you'd like to leave on Facebook for us, especially if you're a frontline worker, by now I think we're talking primarily healthcare workers, but not necessarily. There are other frontline workers as well. People, obviously, customer-facing workers, people who are on the front lines in that regard. Anyone who needs the kind of advice we have for you here, we encourage you to hop on board. Dr. Sourav Sengupta is here. He's with Oishei Children's Hospital and the UBMD. We do have one comment coming in, and this is kind of the ones that I was referring to. While we hope our discussion is valuable for healthcare workers, I think there are points of it that are universal. And Nancy has just written in. She asks, what advice do you have for retail workers that have to go to work and the store is always packed with people? Some customers wear masks, some don't. Some of my coworkers say their stomach is upset their entire shift. Scary.
That's right. I think a lot of folks would understand kind of where Nancy's coming from there. One of the things I'll say that, we've seen in the healthcare worker environment is, we've gotten some really good messaging from our leadership about the importance of still maintaining good physical distance. But it has required a change in interpersonal habits. I'm a psychiatrist. I like to engage with people, but this idea that we need to maintain some distance from folks, I would keep that in mind, even in these essential workplaces. I think it's fair game to be able to remind folks, that we want to make sure that we're keeping everyone safe. And, we want to have folks follow the standard protocols in terms of physical distancing. I know that may not always be possible, right? In terms of, the physical environment, those kinds of things. I also think it's reasonable for us to be able to, so if I have, a customer that's coming a little bit closer to me, I might specifically, put my hands back and take a few steps back, and it's a way to really sort of non-verbally send the message that, hey, we've got to, do some things a little bit differently right now. I think another place here is, I think, along the lines of what Nancy's mentioned, I think this is a great example of a place where it's important to have at least kind of one person that you can share your worries with, and again, maybe that difference between having the one person where you can sort of process it with versus, just the group where everyone's going to share their challenging experience, but being able to sort of have someone acknowledge that, yes, this is scary. This is something that, is not a typical way of doing things.
And that kind of lines up with what we were saying earlier. Kaleida and the people you're working with sort of have these three prongs. The first prong is just kind of outreach, making sure people feel good, making sure that their concerns are being addressed. Prong number two, though, is the follow-up after that. Talk a little bit about the long-term care.
Right. So, again, we might have folks that are, let's say wanting to be able to work with someone for a longer period of time. One of the things then we're able to do is to really try to find someone who would be a good fit for them, and connect them together. And then maybe we would call back in, and check in on the person if they would like us to, and make sure they're doing, a little bit better. They're feeling a little bit better. They're feeling connected. And if not, we'll continue to try to find some ways to be helpful to them. And then, the sort of the last approach we're trying to do is a bit more, just broadly sort of community oriented, which is, one of the biggest things I think it's important is to educate folks about ways that they can continue to work on self-regulation. So we've been creating some brief clips, we're calling them mindful moments, where some of the amazing colleagues that I'm working with, psychologists, psychiatrists, social workers, are really trying to help teach folks some sort of really basic skills in caring for themselves, managing stress, and really trying to make sure that, let's say you've got a little break in your shift, you could come, you've got 3 or 4 minutes, you could take a look at one of these, maybe practice one of those. Or maybe sometimes even when we get the call, we'll sort of work through that with them and say, okay, let's work on the deep breathing exercise. There's a cool video that we can watch together and work on developing this as a skill.
What kind of exercises are in there? Some of the stuff we've covered on previous shows is breathing exercises, or muscle relaxant, that kind of thing. Is that what this is about?
Absolutely. So there's some of those that are right on there. By the way, this is a public facing website. So it's on kaleidahealth.org/coronavirus. If you go down to the mental health care section, anyone can access these mindful moments. But, so those are great strategies that your previous guests reviewed, right? That are really focused on the behavioral way to really regulate yourself. But we might also focus on some cognitive strategies, some thinking strategies as well. Maybe, some ways to specifically kind of fight back against some negative or challenging thoughts.
What do you mean by cognitive strategies? Take me through that. How does that work? What is
Sure.
that?
Yeah, so let me give you an example. One of the things that we find is that when we get caught up in a really strong emotion, oftentimes there's a strong thought that goes right behind it, that goes right with it. And so we might really want to figure out if there's a way that we can sort of work with that challenging thought. And so one of the things we've talked with a lot of folks about is kind of questioning that negative thought.
I'm a healthcare worker. I'm afraid I'm going to catch this. That is a negative thought.
There you go.
How do I talk back to that particular negative?
There you go. So, what I would sort of translate that a little bit too is that the thought that's fueling the worry is not that I'm afraid that. It's in the way we might translate that is the thought that's really fueling the worry is that I am going to catch it.
Okay.
Right. And so we ask ourselves of every sort of challenging thought along those lines, 2 questions. Right? So is this thought accurate? And is this thought helpful right now? And if the answer to either question is no, is there a way that we can find to sort of talk back to that negative thought? So, let's use your example, right? So I'm going to catch this illness, right? So is that thought accurate? What do you think, Dave?
Well, I've got PPE, I've got my shield on, I've got my mask on. There is a certain level of inaccuracy if I am taking precaution.
There you go, right? And so, we might be able to identify that, so first of all, it's very difficult to predict the future, right? That's a challenging thing to be able to do. And that, yes, absolutely, and I'm taking as many precautions as I can to keep my health safe. Absolutely. And then we might also ask that second question, or let's say we had a very accurate thought, right? But we might still ask that next question: is this thought helpful right now? And frankly, what we might say for that is, that might be, again, I'm taking the precautions I need to keep myself safe here. Really focusing on the worst possible outcome right now may not be so helpful for me, right?
So do I then just say, well, okay, I will get this, but thinking about it right now is not helpful? Can I just turn it off like that?
Can you just leave it right there? No, and I think sometimes it's difficult to do that. It's difficult to do that. And for that, sometimes we often also use a little bit of a backup plan. And what we like to sort of have you think about people in your life that are your backup plan, right? Think about, a best friend or a loved one. And what might you do if they came to you with this situation, with this problem? and what kind of advice might you give them? And the fact of the matter is, if it's good enough for your friend or your loved one, it's good enough for you, right? And oftentimes we actually have, really great problem solving abilities, but we don't always let ourselves access those, maybe because of some of these kind of challenging thoughts and feelings we're having. And so if we can kind of keep that backup plan in mind, so what would I tell, my best friend if they ask me about this kind of situation? Okay, well, can I find a way to apply that to what I'm experiencing right now? That sometimes is a way to kind of break out of the box.
I also think it's probably especially easy for a healthcare provider to think, yeah, maybe I'm taking a risk here, but it is a risk for the greater good. That which I do gives me purpose, or at least allows me to go on for one more day, because, hey, in the grand scheme of things, there's worth here, there's value here.
I think that question of how we connect with that broader mission, I think that's really important here, right? So many of us that went into, the healthcare field, we did it for lots of important reasons. We wanted to help others. We wanted to be connected to the community. We wanted to, care for other individuals. And I do think sometimes in highly stressful moments, sometimes we can feel a little separation from that kind of initial sort of, that mission that drove us into, this calling, if you will. And I think sometimes it is helpful, even in these stressful times, to take a little bit of a step back and ask ourselves, is there a way that we can sort of reconnect with what is it that I found fulfilling and helpful, about, going to this field? What are the things that I'm, helping out in this community to make sure that are still happening, still going on?
Because at a basic level, doing that, I see it gives me worth. Suddenly what I'm doing is important, and I can feel okay about it, maybe a little less stressed about it, if I know that it has ultimate value for society in general.
Right. And I think there's a way to really, an important way that we need to extend that, idea even further, right? For essential workers, or, this is a really challenging time. There's a lot of folks out there that, they might have gotten furloughed. They might have, unfortunately, there's a lot of financial and workplace challenges going on. We might have lost a job, things along those lines. And I think there's still a way to connect ourselves with, again, the broader mission, if you will.
The greater good.
Right. We all have worth, we're all essential, and it may be in, making sure that, I'm taking good care of myself, right? That's important. Or maybe I'm doing something to help out, my family. Maybe I'm doing something to support my neighbors, my community. But each one of those, strategies that we take part in, that's fulfilling, and that's important, and that's essential.
All right. We talked a little bit earlier about resources. Normally at the back end of the program, that's when we hit those. I do note that right there on the Facebook page, we've got those numbers up. If there's anyone that wants to share a comment with us on Facebook as we wind down here, you still have a little bit of time. But my closing question to each one of these, Dr. Sengupta, has been, what does the future look like? And I know that no one has the crystal ball, but how do you see this all playing out? Is there a brighter day?
There's a brighter day. There is a brighter day, and I suppose for me, the lens on the future, as always, it runs through the past. Let's just pause for a moment and take a look at how this community has come together during this time. The ways that, again, within every home, people have tried to come together and, support, the family. Right. On the block, making sure that Mrs. Jones, is doing okay. Or, do you need, something, when I make my, weekly run to the store, or, hey, is there something that we can make sure that, we can do something to lift someone's spirits that I know is feeling down over there. Somebody lost someone. Let's make sure that they're doing all right. To this community response. And again, I'm so proud to be a part of this healthcare community. I've just been so immensely proud of the work that folks have done to take care of the folks that are sick and vulnerable. And so to see that, to me, that ingenuity, that passion, that commitment, through that lens, I think is what helps me sort of say that the future will be bright again. We're going to find a way through this. We're going to find a way to, solve the specific infectious disease problems, but we're also going to find a way to tackle some of these social issues, the employment issues. We're going to find a way to come back. But I think what that will mean is still keeping up with this spirit that's brought us this far, which is working together, connecting with each other, and staying kind of as unified as we can be.
All right, doctors, thanks so much for this. This was a fun time.
You bet. Thanks so much.
Well, as fun as a discussion like this can be.
Absolutely.
I appreciate you being here.
Thanks so much.
Dr. Sengupta is a psychiatrist at UBMD and Oishei Children's Hospital. I'd also like to thank producer Lynn Bader, social media coordinator Johnny Moran. The WBFO Mental Health Initiative is sponsored by the Patrick P. Lee Foundation. I'm WBFO News Director Dave Debo. I want to make sure that you're here next week. Join us again. We're going to wrap this series up looking at alcohol and substance abuse and even suicide. Our guest will be mental health counselor Carl Shallowhorn. Put it on your calendar again next Thursday at 4, and we'll see you then. Thanks for being here.